So today we're going to do inverting suture patterns. We're going to use a body wall model, but we're going to pretend that it's an organ. So looking at this model, we will pretend that this layer is the mucosal layer, this layer is the submucosal layer, and then this will be the serosal layer. The most common inverting suture pattern that you're going to use by far in practice is the Cushing pattern. There's a sister pattern to that called the Connell pattern, which is the same pattern, it just goes into the lumen, which is rarely performed. So for the most part, you're only going to be performing a Cushing pattern, which is what we're going to show you today. So the pattern starts very similarly to how you start your intradermal pattern, where you're going to bury your knot. Instead of thinking superficial to deep, you're going to think of the incision being deep and away from the incision as being superficial. For this pattern, it's always performed parallel to the incision, so that's how you take your bites. So to bury the knot on this, I'm going to start by going away from the incision and parallel to the incision. And again, I'm not going to go into the lumen of this model. I'm just going to stay through the submucosa and serosa. A lot of times you can't even see necessarily that you're going through those layers. You learn the feel of what it feels like to go through the submucosa. Then I'm going to back the needle towards the incision to tie my knot. So one important thing that you can do with this pattern, and you should do, is you can notice that my incision ends about right there, but my loop is past the incision. So it's important to kind of over-sew or let this part on the one side of the incision become buried as well. Because the goal of these patterns is to create a very watertight seal. And then similar to when you're burying the knot in the body wall, you're going to pull parallel to the incision to bury that knot as best you can. They won't always bury perfectly, especially in the silicone models. They should in tissue. One thing you can do though, which I'll show you, is if your knot is sticking out a little bit, especially on your first knot, your starting knot, you can over sew that knot. So I'm just going to come back with my first bite, and when I pull on this, it'll invert the tissue over the knot. So for this pattern, I'm just going to do bites that are parallel to the incision. Again, just going through the submucosa, not through the lumen. And you'll see here, as I pull that buried the knot quite nicely. One important thing as you're closing these is that you're going to have to keep tension on the suture as you go in order to keep that tissue inverting. So I'm just going to take bites that are parallel to the incision, at least a couple millimeters away from the incision. The distance away depends a little bit on how much lumen reduction you can allow for yourself. So if you're closing something big like the bladder or a uterus, it's not as critical as that you get as close to the incision. If you are closing something like the small intestine, where luminal reduction is a real negative thing or something you want to avoid, then you would want to come closer, as close as possible to the incision. In general, though, you always have to be at least 2 to 3 millimeters away in order to invert it properly. So to end this this pattern, I'm going to do similar to how you would end an intradermal, where I'm going to do close bites to far bites, which are similar to your deep and superficial. So I'm going to take a bite that's kind of close to the incision and away, and again my incision ends right here, so I'm going to always end my knot just past where the incision ends. And then I'm going to backtrack my needle towards the suture. This pattern doesn't bury quite as nicely as you'll see with the Lambert and the Utrecht pattern. So again, I have my 2 loops. This loop is going to be on the end and is going to help to bury that suture. So I'm going to pull that through, and then that'll help to bury that suture down. Again, it buries a lot better on tissue that is nice and loose and like a hollow organ like the uterus or the bladder. But again, you'll probably, especially on the Cushing, you'll probably have your knot sticking out just a little bit, and that's okay.